Hello, everyone. Welcome to Cracking Addiction. My name's Dr. Fergal Armstrong, and we have with us Dr. Laura Petracek. Laura, I thought we'd start today thinking about the 12 steps. And the first step out of those 12 steps, what is it? How would you explain it?
Well, the first step as written is we admitted we were powerless over alcohol and that our lives have become unmanageable. So there's two main steps in that first step. The first concept is powerlessness, and the second concept is unmanageability. So the first concept is powerlessness. And so for myself, I work with the client. I ask them to either talk about it in session or for a homework assignment, write down all the examples of where their life is powerless because of alcohol use. So I drank, I went to a wedding. I planned on drinking 2 drinks. I had 10. That's an example of powerlessness.
There's just no way that I can say no or that I can control my consumption of substances, be it alcohol or some other substance. And I actually think that the idea that I am in control of my substance use is actually a cognitive distortion. I see a number of patients and who say to me, usually during the first couple of meetings that I have with them, and I say to them, well, what do you think you want to do? What's your treatment goal? Do you want to try and control your drinking, or do you want to achieve abstinence? And a lot of them say, oh yeah, I want to try and control my drinking. And I think to myself, you're here because so many things have happened in your life that demonstrate that you cannot control your drinking, but you're not yet ready to embrace the idea of abstinence, and therefore you think you can control your drinking to some extent. And I see that as a cognitive distortion that I need over time to correct with them.
I like
And the idea for me of being powerless in the face of addiction is a very powerful tool that allows me to help people move towards this idea that it's better to try and be abstinent. What do you think about that?
I haven't heard it framed that way, but I like using the term cognitive distortion because it is. People who think they can control their drinking when all the evidence is to the contrary. And I also
Yeah.
think, though, that's where I would use motivational interviewing because it's very rare that someone who has a problem is going to come in and say, oh, yeah, I'll go for the abstinent route. Sure, sign me up. No,
Yeah.
they're going
Yeah.
to go for the how to
Yeah.
control it. And they will tell you every type of, equation, like don't drink on an empty stomach, don't drink hard liquor, don't start till after 6, you name it. People have a drinking problem have
Yeah.
done it.
Yeah.
So, but that's a good frame. I like that because it is a cognitive distortion. Thinking, in evidence to the contrary, they can't control it.
I once had a patient who said to me that he would only drink light beer and therefore he didn't have a drinking problem, but he used to drink about eight light beers a day rather than 3 or 4 light beers or normal strength beers. And he didn't think that was hazardous at all.
Oh, I know. I mean, or I drink, or this is interesting. This I didn't even actually become as aware until I worked in the field longer, even though I'm in recovery myself. But people would say, oh, I don't drink. And what they really mean is, well, I have a beer, on Saturday, a couple glasses of wine on a Wednesday. But to them, that's not drinking. And that kind of floored me at first.
Yes.
But so our society, drinking
Yeah.
means like drinking every night or really getting hammered on the weekend. So I'm like, or people say, oh, I don't drink when I go through this questionnaire. And then I start asking more details. I'm like, well, what exactly do you mean you don't drink? Because it has a different meaning for a lot
Yeah.
of people. And for most people, that means, yeah, they do drink, but just smaller amounts as far as
Yeah.
they are concerned.
So that's another cognitive distortion,
Yes,
isn't
it
it?
is. That's exactly. Yep.
Yeah. Mm.
Yep.
So how do you, if you confront someone, or sorry, confront's the wrong word. If you meet a patient who's not yet ready to acknowledge the need for abstinence and not yet ready to acknowledge that they are powerless in the face of their substance, how do you move them to that point of acknowledgement? Now, you use the word motivational interviewing
Right.
there. Does that play a significant role?
I think it plays a significant role. I think it is one of the more helpful tools, I should say. I mean, there's a lot of intervention strategies, but I
Mm.
find that motivational interviewing is one of the better strategies in terms of getting the client to look at their denial, to look at, where they are compared to where they want to be, to look at their
Mm.
understanding of their drinking or drug use. So, and
Mm.
it's also, uh, when presented to a client, clients are less defensive about it when you use motivational interviewing, whereas, back in the old day, it was more confrontational, and that tends to have the opposite effect on clients and pushes them away. Like, you were in a car
Yeah,
accident
it
and you
does.
ended
Yeah.
up with a DUI, so you're alcoholic. That's not going to really, kind of
Yeah.
clobbering someone
Yeah.
over the head is not going to help.
Yeah. It
No,
doesn't, does it? Yeah. And you're right. That was that was a way that I was certainly taught. That one has to confront the patient with the truth and the discrepancy between the objective truth and their truth.
exactly. But when I worked at St. Quentin State Prison in the intake department, um, I don't know. I just kind of thought this up one day, and I'd go through their drinking history, and I say, I think there's a problem because when you drink, you break out in handcuffs, and they just start laughing. But it got them kind of relaxed more and listening. Like, hey, if you weren't drinking, you wouldn't
Yeah.
break out in handcuffs, instead of like if you use this medication, you
Yeah.
break out in hives. So I'd say you're allergic to
Yes.
alcohol. And then we'd kind of get the ball rolling there. But when I was more formal and kind of going through the benchmark questions, not a lot was really, there wasn't much of a dialogue.
Yeah.
So I think also to
Yeah.
approach someone in a more relaxed manner, but yet they're still getting the point. Like, uh, you know, if you break out
Yeah.
in handcuffs, there's a problem.
One of the issues that I used to have, which was a barrier to my accepting the value of motivational interviewing, was I used to feel that I was responsible for my patient's behavioral change. And therefore, it tends to be that, if you're responsible for making someone else's behavior change, then you've got to make sure that they truly understand what's going on. And, this is the reality of the situation and it must change. Whereas with motivational interviewing, you can meet the patient wherever they are. And if they're in a situation or if they're in a mindset which tries to minimize their alcohol, that's okay, because you're not responsible for their change.
Right. You don't, um, you're not responsible, and it's like you're not in that mode to try to fix it.
Exactly. You don't
Like,
have to
I
fix it.
remember a
Exactly.
supervisor saying, if I'm working harder than the client, then I'm working too hard. Then I'm trying to be in
Yes.
that fix it mode and having them,
Yes.
quote, stop or see the errors of their way in drinking.
Yeah. Yeah.
But the
Yeah.
motivational interview, yeah, you can kind of sit back a minute or a little bit and not try to, fix it for them. Whereas
Yeah. Absolutely.
before, I would have more of a determined effort, and I think it
Yeah.
Even though I'm in recovery myself, I would use that as a way to try to convince them. And it was
Mm.
just way too much work and not much of response on their part.
There's not much return on investment for that one, is there?
Yeah, exactly. That's it. Not much return on investment. That's perfect.
Yeah.
Yeah.
So, I mean, we both agree then that motivational interviewing really is ideal for helping people accept ultimately the powerlessness of their own powerlessness in the face of a substance use. Is there any other way of looking at powerlessness to achieve enlightenment in this issue?
Well, sometimes I have them look at other areas of their life that they're powerless. I mean, there's also a saying, I'm powerless over people, places, and things. And
Mm.
actually, in most of our life, we're powerless. But for the person who's an alcoholic, they tend to just focus on, I'm not powerless over alcohol, or they struggle with that. But I'm like, okay, well, let's look at, your boss. You say you hate your boss. He dumps extra work on you. Would you say you're powerless over him? Oh, yeah. Or let's look at your teenage kid who, comes home whenever he wants. Do you feel powerless over him? Yes. Or let's look at, the wildfire fires that were raging, ravaging Australia. Were you powerless over that? Yeah. So
Mm.
then I try to bring those other issues in to saying, well, alcohol's similar to those other examples.
Yeah.
You're
Yeah.
powerless. Look at all the data.
Mm.
Your whole chart is says you're powerless.
I listened to a podcast done by Andrew Huberman, the Huberman Lab podcast. Um, and he talks about the only thing you can truly control is your attention and your effort.
Yeah. We could only control our response to the situation. That's it.
Thank you. That's perfect.
You
We can,
know.
yes, that goes back to Viktor Frankl idea,
Yeah, I was just
between,
going to say Viktor Frankl. Yep.
yeah, you
Yeah,
can
we
only,
only
you can
have
only truly
control
control your
over how we.
response.
Yeah,
And
and
that response is about your attention and your effort, isn't it? Yeah.
yes, exactly.
So knowing that, how do we put that into the lens of helping someone with an alcohol use disorder or substance use disorder?
Well, people usually come to me on an outpatient basis initially, and so at first I'll say, okay, let's try it your way. So for the next week or 2 weeks, I'll have them keep a journal, how much they drank, or first, what were you feeling before you picked up the drink? How much did you drink? What did you feel afterwards? And so we'll go over like a couple of weeks of that. And then I'll say, okay, now I want you to not drink this next week and write down, how you felt the day you wanted to drink. What was the urge like on a scale of 1 to 10? And basically, the exercise is to show them they can't really do it on their own because they usually
Yeah,
fail. And
yeah.
then I say, okay, now, and this is in the beginning, I'll say, if your way doesn't work, then would you be willing to try my way? Okay, but my way's going to work, so don't worry about it, doc. All right. And so then I usually up the level of care to outpatient treatment. And if that
Hmm.
doesn't work, then up the level of care to inpatient. So I let it seem
Yeah.
like they're kind of driving the decisions, they're driving the boat. In a way, they are. But
Mm.
most people do not want to start with abstinence. It's unless, like, they're just absolutely done.
Yeah.
So, like you were saying earlier, meet them where they are. Okay, well, you're at a place of, help me manage my drinking better so I could go on living my life as I see fit. You know, um,
Is that possible? Have you ever helped someone manage their drinking so they can keep on going as they see fit?
I have seen, there are a few people I've seen in AA that, like, I had a friend who was in AA probably 10 years. And she said, Laura, I'm afraid to tell you this, but I need to be honest. I do not go to AA anymore. I don't think I'm an alcoholic, and I've started drinking again. And I feel like I'm a quote, normal or regular drinker. And then subsequently, in the past 2 years, I mean, at least on the outside, things look like her relationship seems okay, her job. So I don't know. Maybe she really was an alcoholic. And I've known a few people like that. Like, and even some people have told me, oh, you quit drinking when you're 17. You can't be an alcoholic then. And sometimes it tweaks my mind, like, oh, maybe not. But, I have my whole family is pickled in alcoholism, so I don't want to give it a try. But I've
Yeah.
seen other people who have done okay. Now I've seen plenty others who haven't,
Yeah.
but I don't necessarily believe in that if you have a drink you're going to die, or you know,
Yeah.
I don't go for that hardcore. I don't think it's really helpful.
I don't really see that many people who are truly able to control their drinking. By the time patients get referred to me, they're usually dependent on alcohol. There's no two ways about it. So I spend a lot of my time helping them come to that realization. But something else you said that triggered me is a lot of my clients haven't yet reached rock bottom, even though they know they've got dependency. They haven't reached rock bottom. And
Yeah.
the part of my role, I think, is trying to get them to the realization that they are truly powerless, and they do need to use or get to the point of seeing abstinence as a goal of treatment before things get worse in their life.
I think it is challenging, and
Mm,
the first step in AA talks about a lot of people will only seek help when they hit rock bottom. But then they
yeah,
also say in the subsequent editions, we've seen people, that are younger to try to get sober, even if they haven't, hit rock bottom. Um,
yeah,
so I guess it also means, how you're defining rock bottom. Like, there are, let's say, people who have the job, have the relationship, but like I worked with a man that is in tech and is really high up in the food chain in Facebook. Um, he has a beautiful wife, 3 kids, a gazillionaire, and from all ends of his life, like, what's the problem? Except his wife said there's a problem. So if it wasn't for her, he wouldn't be coming in for treatment. But
mm,
from all the other, like, he's got to look good, and
mm,
but until she kind of put her foot down, he said he wouldn't have come in for treatment. Um, Now, this, I think, would be a good conversation for another discussion, but something that I'm working with him on that I have not done with another client, but this was a way to kind of get him on board, so to speak, was he goes, okay, Laura, I'm going to quit alcohol. I'm going to go to meetings, but I'd like a compromise. I'm like, well, what do you mean? Like, drink on the weekend? He goes, no, no, no. I know alcohol is a big problem, even though I won't tell anyone except you and my wife. But he goes, I'd like to try to be able to use CBD once in a while. That marijuana oil.
I have a
So kind
vague
of like,
familiarity with it.
okay. So he's using it like once a week, but you know what? He's doing okay. So I feel like we've reached a good compromise. Whereas if
Yeah,
you would have asked me that 10 years ago, I would have said, oh no, you're not totally abstinent. So you'll have to find yourself
Yeah.
another psychologist.
Yeah.
Yeah.
Yeah, that's a talk, a series in itself. The role of both
Yes.
THC and CBD in substances. Um, yeah, I just wanted to make the point when I was listening to you and also reflecting on what you've said before. For me, that point of rock bottom is when people do realize that they are powerless. You know, in every story of recovery, there's, you know, if you talk to people who are in recovery, they can always remember the time when they finally said enough is enough. The problem is that we don't know as therapists whether or not the person in front of us has actually reached that inflection point. You can only diagnose it retrospectively.
Well, okay, so that's an interesting point, because like for this man, his wife said enough is enough. You know, going back to the codependent discussion a little bit earlier offline, because he doesn't think that. And I know in the literature or even in the rooms of AA, they say if you, like, you could come into the rooms for someone else, but if you don't stay for you, it's not going to work. If you yourself don't, you know, admit that, hey, I have a problem. So, I mean, that's a good point. If people don't hit that bottom, I don't know. It's
You're not convinced by that.
I'm not totally convinced, because sometimes it's their other people in their life where they've said enough's enough, you get help or I'm out of here. Or for me, it was actually more my mental health that I said enough is enough. But I've also, I'll just, you know, end with this. I remember I did some work as a psychologist in a nursing home or nursing homes. And they took me to this one floor, and I thought, well, these people look so young. What are they doing in a nursing home? And they said, oh, this is the alcoholism ward. These are all the people who didn't think they had a problem. This is where they ended up. And I was totally shocked. You know, like people, someone who jumped out a window, or someone who, I forget the phrase now, but where you drink and your brain just
Korsakoff's Wernicke's that goes through the Korsakoff psychosis.
Korsakoff, yeah.
Otherwise known as alcohol-related dementia.
Yes.
Yeah.
And that just was like a wow. I just was kind of shocked, actually. I mean, I've read a lot about it, but I've never. Yeah, and these were people like in their 30s, you know.
Yeah.
Just really sad. So
it's very sad.
Disease, I tell people, it's no joke. That's for sure.
So we've run out of time, Laura, unfortunately, yet again. I want to thank you for your pearls of wisdom, and I want to celebrate our first point of difference. And I really hope that we can resume this discussion again soon. Thank you very much, Laura.
Yeah, thank you, Fergal.
That's all for today, folks. My name is Dr. Fergal Armstrong, and this has been Cracking Addiction.